Now, as the world observed the International Day Against Drug Abuse and Illicit Trafficking, the Department of Social Development is cautioning South Africans against the use of illegal and unregistered treatment centres that are putting the lives of vulnerable people at serious risk. Social Work Policy Manager at the DSD, Motshabi Nkoane, joins us to discuss this matter further. Very good evening to you. Thank you so much for your time. As a department, you're cautioning South Africans against the use of illegal and unregistered treatment centres. What have you uncovered?
Yes, as a department, we are cautioning our community members about illegal treatment centers because it causes a lot of problems. For example, illegal treatment centers, a lot of time they are not registered in terms of our act, and there are no professionals in the treatment center. And the other thing is that there are no daily structured programs for our service users who are admitted in those centers. And the other thing is that most of them, they live in crowded and unsafe, unhygienic conditions. And there's no proper medical protocols that are being given to them. So we are cautioning our community members not to go to illegal treatment centers.
So I understand that to date, your department has identified 103 illegal treatment centres operating across the country, with the majority in the Gauteng province. How are lives being put at risk as we look at the numbers and also the mushrooming of new centres that are, out there wanting to assist when it comes to drug abuse?
Yes, it's true. To date, our department has identified 103 illegal treatment centers, and most of the treatment centers are situated in Gauteng. And we are trying, as a department, we are doing roadshows to make people aware of the difference between legal and illegal treatment centers. Like I've explained earlier on, the legal treatment centers, they must be registered in terms of our act, our Prevention of and Treatment of Substance Abuse Act. They must offer structured evidence-based programs, and they must be able to offer approved medical protocols. And the other thing, they must ensure that our service users, they have proper accommodation. For example, they cannot mix the young with the old. They cannot mix the females with the males. And also, there must be an approval nutritional plan that is approved by the dietitian. So as a department, we ensure that we make people aware of such issues.
So what are the prerequisites? I mean, you've mentioned some of them. If one wants to ensure that they are operating legally, how are you going to assist those illegal centers to operate legally if they are indeed aiming to assist those who are battling drug abuse?
I must say that substance abuse is a specialized field. You cannot just wake up in the morning and say that you are going to do substance abuse. You need to go for proper qualifications for you to be able to do substance abuse. And to help those organizations or any treatment center that wants to register, they need to apply at our DSD offices using a prescribed application forms that are found at DSD. And they also need to comply with the norms and standards. Like, for example, I've mentioned that they are not supposed to mix females with males. They are not supposed to mix young people with old people. And also they must have smaller issues like your fire clearance certificate, your zoning certificate, and your building construction certificate. So it's very, very critical that before you decide to operate as a treatment center, you must ensure that you comply with our minimum norms and standards. And they also must submit the required documentation to our offices on the issues of medical policies that they have, your nutritional plan that they have, their structured programs that they have for our service users, and they must also undergo health and nursing assessment for detox services.
What are your biggest concerns as you list the prerequisites and also assess what is currently operating out there? What are your biggest concerns when you look to some of the lists of requirements that are not being met?
I think from our department, we are trying by all means to ensure that we admit those that are at risk. However, we have a challenge sometimes that we find that some of our treatments, they become full. But the risk that are associated with the ones that are illegal, sometimes our community members, they become so desperate. They'll go to such illegal treatment centers. And like I've mentioned earlier on that sometimes when you go to an illegal treatment center, you put your life at risk. Because remember, it's not registered in terms of the act, and anything can happen. You are not safe in that environment. There are no structured evidence-based programs that are happening in that environment. The other danger is that they don't even offer approved medical protocols. You know, sometimes you find yourself that they even you are being put in a crowded and unsafe and unhygienic condition. So those are the dangers. And whereas the other thing, even issues of medication, they just give medication as they wish, as they want. They are not being informed by medical protocols. So those are some of the dangers of going to illegal treatment centers.
Yeah. Thank you very much. Thanks for speaking to us this evening. Social Work Policy Manager at the Department of Social Development, issuing that warning there, Motshabi Nkoane, urging the unregistered substance abuse centers to ensure that they are registered with the department and comply with the rules and regulations.